Hi everyone, it's Laura Smith, SLP Mommy of Apraxia, and I am here today with a special guest. This is Breanna Waldrup. Did I pronounce that right?
Yep.
Yay! And she is, if you don't know her, you should. She is so heavily and highly involved in the apraxia community. She's an amazing speech language pathologist. She's a fellow apraxia boot camper. She took the Apraxia Kids Intensive Training Institute in 2018. She is the owner of Apraxia Dallas. So anyone who ever contacts me on Instagram or Facebook, I will likely always be sending you to Apraxia Dallas, is where I would recommend. So she is also the director of Childhood Apraxia Treatment, and she is the North Texas Walk Coordinator for Apraxia Kids. So, Brianna, welcome.
Thank you. Thanks so much for having me, Laura, for making this happen. So, really glad to be able to be on here today and share some information with everybody about child apraxia treatment and the Once Upon a Time Foundation. So,
Yeah.
and yeah, I think you covered everything. I'm kind of, I'm just like, kind of apraxia at work and apraxia at home, and some of the things I do I get paid for, and some are volunteer, and just
Yeah. So what got you interested in apraxia and passionate about it?
After I'd been a speech language pathologist for a few years, I had the opportunity actually to come to work at Apraxia Dallas. And that I took over ownership in 2016. So this was a few years before that. And I had been working with just in early childhood intervention with a lot of young children that I saw red flags for apraxia, but I just really did not know very much. Like most speech language pathologists, I had learned about two things
Yeah,
about CAS
seriously.
in graduate school. Well, it was like children with apraxia grope and they make slow progress. Seriously,
Right.
those are like the two things I learned. And I think I went to a fabulous program. It's
Yeah,
just
yeah, you're
so
not
much to cover. And
absolutely.
yeah, so I had the opportunity to start Apraxia Dallas and be able to have a great mentor in learning apraxia, and then of course doing a lot of continuing education, and then it was just once I started working with these children, it's just really so much of that truly something just really connected to me with these kids, having a voice that needed to be heard, and just, wanting these children to be able to be seen. I felt so much of the time they just weren't seen and heard. And so that just connected a lot with my own story and history. And so, that's just where then it was just like, okay, and then I'm full into apraxia world and trying to learn more about how to help these children and families, and just you, and also having been doing apraxia therapy now for several years and really involved, then of course that a lot of our families, I work with them for for years, and so they become like
Yeah.
family, and so then just really wanting to really do as much as I can for these children and their families. So that's kind of where it all comes from.
Oh,
So
I love that. Well, definitely the apraxia community, myself included, appreciates you. So,
thank you.
those kids are special to me too. So, we're really here to talk about the Once Upon a Time Foundation, DTTC, how this all fits together, childhood apraxia treatment. Can you talk a little bit about? You said you were the, let's see, make sure I get it right, director of Childhood Apraxia Treatment, and this is a private foundation. And what's kind of the goal? What's the mission statement?
Sure. Yeah. So, child apraxia treatment, our goal is to educate parents and speech language pathologists about evidence based treatment for childhood apraxia of speech. So, and we are a program of the Once Upon a Time Foundation. So, Once Upon a Time Foundation is a nonprofit private foundation that's headquartered in Fort Worth, and they fund a variety of different projects, a lot related to medicine, but some in the
Oh,
arts and
wow.
education as well. So child apraxia treatment is one of their programs, but that's of course the one that I'm primarily involved in. So, and yeah, that mission is just to provide really high quality information for parents and SLPs about CAS. And to that goal, that's why we offer online trainings for SLPs. But actually, one of our courses, so several years ago, the foundation started working with Dr. Edythe Strand,
Yes.
who we all know and love, and
Queen.
yes, and are in awe of.
Absolutely.
um, so several years ago, started working with her to provide trainings for speech language pathologists. And as a nonprofit, we are able to offer those trainings at no cost. So at this point, we have two online courses. So we have a 90-minute course that's just a general introduction to CAS, and that's by Edythe. And it's actually really great too for parents and grandparents. Like, it is pretty introductory, doesn't get into a lot of SLP jargon. So it can be a great one for really anyone. But if you are an SLP and you want to earn continuing education, you definitely can. And then we have a 4.5-hour course that's also available free of charge. That one definitely gets into a little bit more of the nitty gritty, goes into a bit more detail, obviously. So more for speech language pathologists, although again, it's open to anybody who's interested. But that one gets into a bit more about diagnosis and definitely treatment, and definitely DTTC, or dynamic temporal and tactile cueing. Um, and then historically, we've also offered in-person 2-day advanced workshops, and where again, one of our experts teaches those courses. So either Edythe or Sue Kaspari or Dr. Ruth Steckel or Dr. Maria Grigos teach those, and again, offered free of charge to speech language pathologists. And those again go into even more detail, and then also do hands-on. You get more hands-on practice with trying the techniques, with explaining things to parents, things like that. And those have been on hold for the past year due to
Yeah.
COVID, but we're very anxious to get them started again. So we're kind of monitoring and we're looking, and I'm, fingers crossed,
I
hoping
know.
that we'll be able to get something going. I really hope by the end of the year, we're going to be able to have those courses rolling again, because there's definitely a need. And
Yes.
we're just really, again, the goal of the foundation is to have as many speech language pathologists as possible knowledgeable about CAS and competent in treating CAS. So that's really our goal with these courses. So we really want to get those advanced courses going again.
Yeah, I love that. Honestly, anytime people ask me on my Instagram or social media about a training that I would recommend, I am trained in a bunch of different things, but
Mhm.
the training that I always recommend is that training that's offered through this foundation that Breanna is a part of. So, where can they find this?
So if you go to childapraxiatreatment.org, that's our website, and then you'll see, and the childapraxiatreatment.org/continuing education is where you'll see our online courses and the advanced workshops, which are again on hold right now, but once we have those scheduled, that will be posted there. Of course, we'll also announce anything like that on our social media. So Child Apraxia Treatment on Facebook, Instagram, and Twitter.
Yes, and
And
follow them, you guys, because they have, I mean, you're smaller. I feel like you're not getting the attention that you could because the information, or that you should rather, because the information you guys post is awesome. So I'm always
thanks.
liking it, and it's really good quality information. And it's just amazing that SLPs could get this training for free, and you can get CEUs. So there's no reason not to do it.
That's true, and it's pretty easy to break up and watch in pieces.
Yeah.
For the online ones, you can definitely watch them in pieces, and the videos are actually on YouTube, so you can even do that, and then actually log into the course, of course, to like take the tests and stuff. But if you don't have time, like over a lunch break or something like that, you can just pull stuff up on YouTube, and watch. Watch portions of the course. So try to make it really accessible. And yeah, our social media is kind of new. So we've really been working on that in the past several months. Because part of one of our other projects that we really started, so yes, for several years now, we've been offering the workshops and everything. But just in the past several months, we really started trying to expand our website to really have a lot more information for parents. So we really believe that parents can understand research and that they are, and we know so many parents are doing everything they possibly can to advocate for their children. So we're really just trying to provide that good, high quality information for parents to be able to access and then use to help them um, know what would be a good course for their child, or to be able to make informed decisions about
Yeah.
what type of therapy frequency. Also, we know that literacy is a big concern for a lot of children with
Mhm.
apraxia, so we have a whole section on literacy. So we're trying to also get out good information for some of those related issues that are really common. So we've been just adding lots and lots of new content to our website, especially in our section for parents, to really try to again provide just that, whether you're brand new to CAS and the diagnosis, or you're a little further down the road and running into some of these other frequently co-occurring issues, trying to provide that information. So with that, that's kind of when we started really trying to start building our social media as well. Again, hopefully trying to get content out there for parents and therapists.
Yeah.
So,
Yeah. I mean, cause like, I preach this all the time, but I think my biggest once I went through this whole experience with Ashlyn, and I always say too, I had like 14 loose leaf papers on apraxia, and what I remember is being told it's so rare I'll never see it, and yeah, like that's pretty much one of the main things I just remember hearing, which is just crazy if you think about my life now. Um, like
yes.
boy, did they not know what they didn't know. But I think what's so frustrating is therapists think they know. So you
Hmm.
come out of graduate school and you're given your certificate of clinical competence, and we are told you are the expert on all the different speech and language disorders. And yeah, like you kind of come out and feel like you are. And what my message always is there, yes, you have your certificate of clinical competence. However, you can't, none of us can be an expert in every speech and language disorder from birth all the way through the lifespan to geriatrics. And
Hmm.
that is what that certificate technically means. Like, or that's what therapists think it means. It
Hmm.
means you know about all of those disorders, but to be a true expert, I do really feel like if they're in whatever you go into. I mean, if I were to go into feeding and swallowing in a nursing home, I am not competent enough to do that job.
Right.
That
For
is,
sure.
I would have to go and do some sort of additional postgraduate training or something if I decided to completely switch gears, which I'll never do, and go into that field, or that
Hmm.
area. So it's the same with apraxia. So what I always worry is that therapists think they know. And a therapist who thinks they know how to treat apraxia is much worse than the therapist that's like, yeah, I didn't really learn a lot about this. You know what I mean?
Hmm. Hmm.
So,
Yeah, I agree. And I think too, I mean, I definitely remember being that way for sure when I came out of graduate school, got my C's, and I was working in early childhood intervention. So I saw children with, like all kinds of feeding, swallowing, just everything, cleft palate, and everything in between.
yeah,
And then, yeah, you're expected to know how to. And so it took me, if a few years as a clinician to then kind of realize what I knew and what I didn't know. And
totally.
being able to then be confident enough to say, I don't know.
Yes.
And to then either, seek more continuing education or make those referrals. And I'll tell you now, I make more referrals now than I did clinician, because I do know what I know, and
Yeah.
I know what I don't know.
Yeah.
And I am comfortable saying, okay, like I'm very good at screening for issues with this.
Yeah.
So I'm
Yeah.
seeing things that make me concerned about this, but I am not an expert in this. So please go see someone who is.
Yeah. I
And
love
that
that.
comes up with a lot of different issues. And in our children with apraxia, I do primarily see children with apraxia, of course, at my practice, because I get lots of referrals from SLPs who I love, who say, I don't know, or I
Yeah.
think maybe go see someone who knows more than I do.
Yeah. Exactly.
Perfect.
Yep.
And then I can see and comment on lots of times on apraxia, but then other things come up.
Yeah.
And so then there's like, okay, maybe there is apraxia, maybe there isn't, but then maybe there's also
Yeah,
something
totally.
else where then I'm saying, "Okay, sorry, mom, but, like, there's another piece to the puzzle, I think. So
Yeah.
please, let's loop someone else in who can really help us on that piece of the puzzle. So, but yeah, just we're hopeful, the foundation's goal is that, more and more speech language pathologists are not going to think they know, but actually really know, or again, it's just kind of that thing where you know a little bit more
Yeah.
and you're
Yeah.
like, oh, okay, I know enough to
Uh-huh.
know that we need some more help on this.
Yes, exactly. Yeah, I
Like,
do. That's exactly right. Totally. So,
um, well, and let me tell, we'll talk more about DTTC for sure, but I did want to mention one other big thing that the
yeah.
foundation are doing recent months, and that is funding some new research on CAS.
Oh, I
So,
just saw there you got
yes.
didn't is it you guys that are doing the well go, you tell me.
Oh, sure. So we're so we're helping to fund a multi-site research study on treatment intensity using DTTC, and that's being led up by Jonathan Preston, Trisha McCabe, and Edwin Moss. So
Whoa, that's
yeah, it's going to
amazing.
be a
And it's an
randomized
RCT,
controlled.
right? Yes, that's
Yes, it's
so
a
exciting.
randomized control trial. Yes, so super excited to be funding that, and really excited to see the information. And again, our goal is to provide, high quality information that clinicians and parents can then use to make, the best and most informed decisions they can for their kids. So, and that's, so there's going to be more announcements along those lines. We can't say
Yay.
anything official yet, but we're really excited about that study for sure, and really dedicated to funding some other projects as well. So we'll look for announcements in those about those things in the coming weeks.
Yeah, that's huge. That's so exciting.
Yeah, yeah. So it'll be a little while before we have answers from that, but
Right.
it's
Yeah.
coming and
Yeah.
it's really needed. So, and such
Yeah.
a awesome team there with so
That's quite the lineup of names for sure.
yeah, so it's gonna be a fantastic study.
Well, and just to have the randomized control, like for those of you that don't know, that type of study is like meets the criteria of the highest form of research, and we don't get to do those studies a lot because A, they're expensive, it's hard to fund. Are there other reasons why they're so hard to get done? I guess apraxia is rare too, so
Exactly. That's what I was going to say. That's the other thing is apraxia is rare. And especially, for research studies like this, we also have to limit variables. The researchers have to limit variables. So then we end up, there's children who have apraxia and other diagnoses that then aren't eligible to be in the study
right.
because of the nature of trying to limit variables and things like that. So that also makes it tricky to find children who qualify as participants. So that's some of the reasons that, or for the studies we do have, the numbers tend to be smaller.
Yeah, yeah.
Um, you know, but yeah,
For
but
those of you that don't know, Trisha McCabe is in Australia, so this is like truly an international undertaking. That's amazing.
yeah, yeah, no, it is, but and amazing and exciting. So can't wait to see more information. And also, when they are ready to enroll participants, then we'll be helping to, publish that information about how parents can look into having their children participate. So
Oh, that's cool. I'll disseminate that when you get that too.
yes, yeah. So
Yeah.
whenever they're up and running and start recruiting, then we'll be sharing that information. So.
Yeah, awesome. All right, so I do get asked a lot, what is DTTC? So of course my first, what I'm going to tell people is go to those trainings or go to
Mhm.
YouTube and look at those videos. But it is
Mhm.
nice to just have someone kind of give an overview of the framework and principles of motor learning that is incorporated within this framework. And of
Mhm.
course, that's what Dr. Strand is, teaching about.
Mhm.
But if you could just take us through what this treatment approach entails.
Sure. So just a little background. So it was, of course, developed by Dr. Edythe Strand based on her research and clinical experience over the course of more than 20 years. And she was at the Mayo Clinic, as many know, for many years. So she did design DTTC specifically to treat children with CAS. So not all treatment methods that are used to treat CAS were designed specifically, but it was, and based on the principles of motor learning. So principles of motor learning are those principles that we think about, like as far as organization of practice, and things like that, as far as, are we doing blocks, are we doing distributed, are I don't want to get too much into
I
all
know
of
you could literally
those.
talk for like 5 hours on this, but yes.
Right. So Dr. Strand was thinking about those principles, and incorporated those principles into DTTC. And then since she started using it, and of course, like she started developing it and was using it with children. And then there have been a number of research studies using DTTC over the years. So whenever Liz Murray and McCabe and Ballard did their review of what research we had for treatment of CAS that was published in 2014. DTTC was one of the ones that was shown to be effective in treating. So we have enough research to say, hey, yes, it is effective in treating CAS. It was shown in particular to be shown effective for treating children with moderate to severe CAS. So it is the things it's kind of known for, I think, are really multi-sensory cueing hierarchy. A lot of clinicians, when they go to the training, they talk about the cueing hierarchy. And so that Dr. Strand develops that where it's like you start an imitation. So clinician says it, child says it. If the child's not successful, you increase cueing. So one thing you do is simultaneous speaking where the clinician says the target at the same time as the child. Using slowed rate, it also incorporates visual cueing if the child needs it, proprioceptive cueing, tactile cueing. So as much cueing as the child needs to be successful. So the idea is that you're helping the child improve their movement accuracy using as much cueing as they need, but then it's dynamic because so if the child needs more help, you give them more help immediately, and then as soon as they need less help, you're taking the cueing away, or fading cueing as we call it, so that they're becoming more independent and we're moving from movement execution to really movement learning. So those are the couple of things. So that hierarchy of kind of, here's more help, here's less help, and all the steps in between. Is one thing that it's really known for. And then again, that dynamic piece, as far as that the clinician is constantly changing depending on the child's response. So there's no like, okay, we're going, I mean, sometimes you do say, okay, we're going to say this word 25 times, but it might look different every single time as far as, what the clinician's doing and what the child's doing.
Yes.
So that I think those are the big things that it's really known for. It's also, I think, known for the high number of repetitions. And again, just those kind of principles of motor learning, of thinking about what targets we're selecting and then how we're organizing those targets to be practiced. So,
So
and
I'm
oh, no,
just going to ask you questions that I get, like as parents
sure,
watching you. I obviously know the answers, but it's easier if I, for interview purposes, do it this way.
sure.
So a question is then, how do you decide what targets to choose?
So and we get that question a lot too from clinicians. And so for DTTC, there's no like word list or anything like that. It's all individualized to the child. So you really have to look at what the child's able to do. So what is their phonetic and phonemic repertoire? You think about, so those are the sounds they're making, like what movements can they do with their mouth to produce sounds? And you kind of also think about the patterns of those movements. So as clinicians, we think of those as syllable shapes or phonotactics. So things like, can the child do a consonant vowel combination like me? Are they able to do a consonant vowel consonant combination like mom, or a consonant vowel like mommy? So we think about those things as well. And then you definitely want to think about motivation and function. So what does the child want to say and what is useful for them to say? And that's part of the reason too that it's all individualized, because if we're picking a target that we're going to practice hundreds of times, for this
Right.
child to learn, we want it to be powerful and useful. So we think kind of too about the different functions or uses of the words. So all of those things go into, especially for a child who's just starting out, which again, DTTC is, been shown to be effective for kids with moderate to severe CAS. And as hopefully everybody knows, CAS does evolve and change over time. So with appropriate treatment, those characteristics do change and hopefully lessen. And so the severity of CAS will often lessen over time. So DTTC can be really great for kids who are just starting out. It's not going to be their treatment for forever. So when
Mhm.
we talk about this careful target selection, that's because often we're using DTTC with children who are just starting on their journey. So they might not have very many words at all. So we're
Right.
really thinking very carefully about what what words we're going to really practice. But Dr. Strand, in her experience, a lot of times with intense treatment and DTTC, after about a year, kids were ready to move on to other therapy approaches because they
Mhm.
don't fit into that moderate to severe category any longer. Their speech and their accuracy has really improved such that they're ready for other approaches. So that's when we talk about this like careful selection of these targets. This isn't for children who are probably not for children who are really, at the phrase or sentence level, things like that. Those children have probably already moved on to where another approach is more appropriate. So,
Yeah. You know what's interesting though is that sometimes I will get those children who I feel have moved out of that DTTC stage and like we're kind of onto other stuff, like, a different approach. I might be able to use more of a phonological approach, but being mindful of the principles of motor learning,
mhm,
still looking at the movement gestures, making sure I have accuracy. But sometimes it is just not happening. Like it is just not happening. They're not getting it. And so I will draw back to
mhm,
a small set of like 10 functional words with the sounds targets that I have, like, that they have in error. Like, for
mhm,
I have one kid right now that a velar, like a phonological approach for his velars should have worked, but
mhm,
it hasn't. So we drew it all back to functional words. He's speaking now. He's in sentences, but we drew it like his sister's name starts with a K. He lives on a farm. He actually does have a cow. We always talk about in the city, cow is not a functional word and moo for kids, but in a farm it is. And so we drew it all the way back, and she just texted me this morning. I've been doing this for about 2 weeks now, and she just texted me this morning and was like, my husband and I noticed a huge difference. It's generalizing all over the place. And I was like, yeah. So I mean, actually, like sometimes I do bring
well,
them back to that approach.
yeah, I do too, and especially when it's a new movement pattern.
Hmm.
It's a new movement gesture.
Yeah,
Like
exactly.
he didn't have any movement gestures that were those back sounds or velars.
Yeah.
Then sometimes for children with CAS or a history of CAS,
Yeah.
then that is really, again, going back to those principles of motor learning. And
Yeah.
I see that too a lot on like multisyllabic words, even as my kids are getting
Yes.
older and they're conversational and everything like that. But, those multisyllabic words can still really trip us up. And so it's just like, okay, well, let's do a block of it and let's use
Yeah.
more cueing and then, and
Yeah.
then we fade and everything as appropriate. But yeah, definitely. And that's and in my practice, we DTTC it. It's kind of our
I love it.
we talk about our kids all the time, a kid will be like at a higher level, but it's like, I think I need to DTTC this. So
I'm gonna start using that now.
we've
That's
kind of
awesome.
made it into a verb and just meaning that we're thinking about all those principles of motor learning. We're thinking about that cueing hierarchy. And
Yeah.
that's what we're going to use for that goal,
Yeah.
even though we might be working on a lot of other things that we're not really so much thinking about principles of motor learning on. Maybe we're working on lots of language goals and
Yeah,
other
right.
things, but for that goal, we're gonna think about DTTC.
Yeah, yeah, I love that. I'm gonna
So,
DTTC it. I'm gonna have to start using that. That's hilarious. It's so true because
yes.
I do end up having to do that every once in a while. So,
Yes,
um
definitely, definitely, yeah, no, that's probably a weekly phrase here.
Yeah, so I guess my point in saying that too is just to let people know that even though it's designed for children in the moderate to severe range, having this knowledge under your belt, what all the training encompasses, knowing the framework, knowing the hierarchy, knowing principles of motor learning is going to take you so much further as a therapist. Like
Mhm,
in general, it's just going to make you a better therapist having this like kind of base understanding. So
mhm.
anyway.
That's definitely our hope. So,
Yeah, yeah, no, I think that you guys are doing great. Like this is so awesome. While you were talking, I had a question. I thought of a question that other parents like that parents will ask me. In terms of cueing, so really, DTTC is kind of built on that, what Breanna's saying, a hierarchy, but cueing can be involved. So is there, what parents then want to know, well, what are the cues? Teach me the cues.
Mhm, mhm.
So talk about that.
Yeah. So there's no specific set of cues used in DTTC, and what what we usually say is that it's what cueing works for that child at that time. So again, it's really individualized. So, and you'll hear Dr. Strand and Dr. Steckel say, and I'm sure you found this, Laura, in your practice. I found it in mine. I know different cueing techniques.
Hmm.
I have prompt training. I know visual phonics. So, and I use those at times, but there isn't necessarily one cue that's going to work for every child in every situation. And so a lot of it's just like what works for that child at that moment. And a lot of times it has to do too with the error that they're making.
Hmm.
Like what kind of help do they need? If they don't need help with lip movement and closure, then doing a tactile cue for their lips, they don't need
Right.
it. So let's not use it, right? Or if their error is
Yeah.
something different, if they're making a nasality error, saying a instead of a b,
Hmm.
then that's kind of maybe going to be a different cue than
Yes.
we would use if they're saying a duh instead of a buh.
Yeah.
So things like that. So it's just there is not any one cueing system. It's really individualized. It's whatever you need to do in that moment to help that child improve their movement accuracy to be able to say that word accurately. So uh,
Yeah.
yeah, and that's tough because it would be easier if there was just like, "Here it is," and we wish that there was. Uh,
Yeah.
but, it does take a lot of skill on the part of the clinician
It
and
does.
a lot of that training and then also a lot of practice,
Hmm.
and that's that and I tell families that's a catch-22 because apraxia is rare,
Hmm.
and so, definitely, obviously, having the knowledge is better than not for a clinician, but then it's also just experience. And that can be kind of tough if you haven't seen many children with apraxia. So just, but I've seen clinicians who are really devoted and they just, they might be learning with your child, but they're learning and they're going to get better. And
Yeah, yeah. I
so,
mean, the clinician who's willing to go out and learn and admit they might not be an expert in it, a
mhm,
lot of times ends up being a better one than the person that's like, well, no, I just had a parent tell me the other day their SLP discharged him because he just didn't work with her, and he's the only kid he's ever had that didn't cooperate with her, leaving the impression that it's somehow the kid's fault that the clinician wasn't making progress. Like, hello, people. Like, can we have some introspection here? Like, if you're not making progress, when is it ever the kid's fault? Like, the answer is it's never their fault. Like, you literally have to figure, maybe you're not the person for them, and then that's okay. Like, or maybe
right.
they have something else going on, but like, figure it out. Don't just discharge them and be like, sorry, they won't work with me, and I've never had a kid like this. So figure it out. Like, what?
Yeah, yeah, definitely need to provide resources because yeah, if you're not the right
Yeah.
person, which sometimes you're not, and
Yeah,
that's
exactly.
but and I don't know, for me and a lot of the clinicians I know when when you're not making progress, that's what keeps us up at night. And
Yes,
like you're like racking
exactly.
your brain, like what we're for, and that's what, a lot of my discussions with other clinicians are is like, what else can we do, or what referrals do we need to be making? What are we missing?
Yes.
What needs to happen here? And another service that the foundation offers is we do, we have our wonderful experts that are available. So we do answer questions from families. We do review
Oh,
video
awesome.
clips
Oh, wow, that's
of
good to know.
kids, and we do that for therapists too. So of course, if it's a clinician sending us a video, of course we're getting consent and things like that signed from the family. But we are happy to have those discussions and help out, like provide some guidance again for clinicians or families of like, okay, here's what we're seeing. Of course, this isn't a full evaluation or anything like that,
Yeah.
but here is what we think, comes to our experts mind of directions that we think that this child should be going, or suggestions for therapy, things like that. Or yeah, I do get that question about targets, and again,
Mhm.
when it's individualized, there's no just like we can give some general things, but I do like brainstorm through with clinicians of like, okay,
Yeah.
what is the child's repertoire? okay, what is meaningful for this child? Okay, how about here are some suggestions, and a lot of times just tweaking. Like clinicians have great ideas,
Hmm.
and then especially if they're not succeeding with something, being like, okay, what's another way? What's another cueing technique we could use to succeed? Or how could we tweak that target into something that maybe the child could be successful with?
Yeah, when I do consults too, mine are paid though, but, I do consults too, but typically the overarching thing that is always I'm gonna be leaving them with is that the therapist hasn't faded the cues. So
Mm,
the child can do X, Y, and Z, but we're just not getting anywhere in terms of generalization and
mhm,
carryover, and that's usually the problem. So cueing is important. Another reason why DTTC learning about it is so helpful because in the hierarchy itself, built into that hierarchy, you are going to naturally fade all cueing to a point where, you get that independence. Like that's the whole point of DTTC.
mhm.
So,
Yeah, that when I was went to my first DTTC training several years ago, that was before I worked for the foundation. That like learning about the delayed imitation, even having read the
yes.
literature and something that stuff that was something that I had just really not gotten. Like I got the simultaneous and
Yep.
then I got imitation, but then it's like we kind of went from imitation to kind of
Yeah.
like, and so I had missed that delay
Yeah.
imitation, and that can be really powerful
So powerful.
for a lot of kids to really get them to that generalization, to really gain mastery of that motor plan, to really move it into true motor learning and
Mhm.
not just motor execution. That delayed imitation is huge.
Oh, I
So,
love that you just said that because Carrie and I on Carrie Ebert is an apraxia expert, and we have a series called Uncorked, and we were just talking about how there's a difference between motor performance and how the child
mm,
is acting in therapy and what they're able to say, but motor learning, like for true
mhm,
motor learning to have occurred, that these are why the parents are consulting, is because it's like how come we don't have independence, and it is exactly that, is because the child only has motor performance, they do not have true motor learning, and to bridge that gap, like Breanna was saying, that delayed imitation can be so, so powerful.
yes, yep,
Yeah.
yeah, definitely. So,
Yeah.
definitely some that's like, oh, well, yeah, like we said, Edie's a genius.
I
So
know. Like seriously, this woman, I
it's
can't.
like, oh, that's why it's there. That makes so much sense and it works
I
so
was
often.
I was just like you though. I think it is like we all want to jump the gun, and with typical speech disorders, we don't need to
Mm,
have this. We don't need to
true.
do all this crazy stuff to try and get carryover. I mean, there's stuff we have to do and there's stuff we intentionally do to get carryover,
Yeah.
but it's not like this. Like this is just a whole different animal because it involves motor learning. So, I miss
Mhm.
that too because I think the natural inclination, yeah, I knew, the framework, and yeah, I knew the hierarchy, but yeah, the inclination is like, okay, simultaneous production, direct imitation. Now we got it. And like, no, like it really is this like extra little step there, like so powerful.
For sure. Yeah. And that's if you don't do like initial like mime, if you don't do miming or initial placement cue or something like that, because it's like, oh, and then there's little shades within that too.
Yeah, for
So,
sure. Or even
complicated business.
feedback. Yeah, feedback too is
Feedback
another
for
thing some
sure.
people have to fade as well. But feedback,
Yes.
is feedback incorporated into DTTC?
Definitely, yes. That's, definitely another one of those principles of motor
Yeah.
learning, that's definitely, and so thinking about, again, as you're going through with a target of moving, of course, lots of extrinsic feedback where you're telling the child how they performed, but going from more specific, like, "Oh, you forgot to move your lips together," or something like that, to, um where you're more just telling them right or wrong. So just that knowledge of results, yep, that was it, or no, so that the child is then having to think about, oh, was that right or wrong? So yeah, definitely that's included in DTTC as well. Definitely included in the trainings. Dr. Strand covers that as well. So
Well, awesome. This is just such an awesome resource for our community. I'm so happy to be a part of helping you get the word out. Thank you for all that
yeah.
you do. I mean, you're a rock star. I can't even believe you hold all these roles. I mean, I can because people say the same thing about me, but
I'm sure they do.
it is because when you're passionate about it, it really it is work, obviously, but it doesn't feel like work. So, I mean, it is work, but you know what I mean. It's
I for sure, right. Yeah,
yeah.
no, that's what I'm just like, it's my work, it's my personal life.
Yeah.
It's just kind of all kind of goes together.
Yeah, yeah,
But thank you so
exactly.
much for having me and for helping us to get the word out. And it's just, again, another resource that we want families to be aware of, and not just an additional resource. So that we
Yeah,
want everybody to be aware of, in addition to all the other fabulous resources, like all of the information you put out, all of the great information that Apraxia Kids puts out, everything that
absolutely.
Carrie
Yeah,
does.
yeah.
So
We
just
all got to work
another.
together.
Right, exactly. So just another resource we want parents and clinicians to be able to access to really help their kids and meet their needs. So.
Awesome. Well, you guys, I'm going to tell you again, please check out Childhood Apraxia Treatment. It is on Facebook, Twitter, Instagram, and they are putting out great information for clinicians and families. Check out their website. Is it the same like childhoodapraxiatreatment.com?
So it's childapraxiatreatment.org.
Oh, that's what I always get wrong. I say childhood in it. Child, yeah,
Child
apraxia.
Apraxia Treatment. Yep.
Okay, thank you. Yes. Yeah, so make sure you check them out. So thank you, Breanna, so much for being here today.
Thanks, Laura. Thanks for having me. Great to talk.
Bye, guys.